Thank you, Anna. So it's an absolute pleasure to stand here and be talking about prevention. What's new for prevention, what's in the pipeline, and what we currently have available to us. So as you know, sexual transmission of HIV can be prevented using a variety of modalities. Everybody knows about the condoms in males and females, as well as the dapivirine ring. But we also have different types of PrEP, or pre-exposure prophylaxis, delivered through different ways using different drugs. And as Anna has gone through, there's also U equals U, or undetectable equals untransmittable, and its treatment is prevention. So there's different ways of preventing HIV in all different populations. So PrEP has evolved over the years, and what this slide shows you, it reflects an incredible amount of investment and courage from communities who've come forward to participate in trials, testing a variety of PrEP products in different populations and in different countries across the world. And there are a variety of products that have made it into the pipeline, and some products are beginning to come out of the pipeline, going into guidelines and being available for use in the clinic. So the current guidelines regarding PrEP use involve 3 types of products. There's the tablets for oral use, swallowed by mouth. Then there are injectable products, and then there's also the vaginal ring. So WHO have released guidelines throughout the years, 2021, 2022, there's new guidelines that have come out. And right now there is the tenofovir-based oral PrEP, and that should, as you can see, should be offered as an additional prevention choice for people at substantial risk of HIV infection as part of combination HIV prevention approaches. And I think we've heard from this morning how it's not just about taking a tablet or taking some drug. There's many more determinants of HIV risk that need to be managed as well. So PrEP is part of that package of care to prevent HIV in people who find themselves at risk. So as well as oral tablets, there are injectables, and cabotegravir long-acting is making it out of the pipeline, and that now is incorporated in WHO guidelines, again, to be used as an additional prevention choice for people at risk of HIV. Likewise, there's a dapivirine ring, which is a vaginal product that can be used as part of a prevention package. Something to note is that once the medications make it through the pipeline, different countries then review the evidence and come up with their own set of guidelines for use in their own setting. So always go back to your national providers to check what is available and for which populations in the country where you happen to be. So looking forward, what's in the pipeline? What can we expect to see? We've spoken a bit about the oral tablets, and we now know cabotegravir long-acting injectable preparation that can be used for PrEP. And that has been tested in studies, and now many different groups, in fact, possibly some of you sitting here, are beginning to look at how we deliver that product in the community, more into the implementation of such a drug for PrEP. It's not the only injectable product. There's lenacapavir, which is also being studied as a prevention product. Likewise, there's broadly neutralizing antibodies, and then groups are still working to optimize oral PrEP, including developing a longer acting preparation that maybe does not need to be taken by mouth every day. So there are products in the pipeline, and we're continuing to do research to come up with a product that suits people where they are and their own particular circumstances and their choice. So we're finally getting to the stage where in the clinic we're able to offer a choice. And it's been decades to get to that stage. So it's quite success that we're sharing with you at this stage. So starting with the daily oral PrEP, various trials have been done, and the Discover is one of them that compared a different type of tenofovir, which is called tenofovir alafenamide, also called TAF. And TAF with emtricitabine, TAF-FTC, compared with TDF, which is the traditional tenofovir disoproxyl fumarate type of tenofovir PrEP. And they were able to show that daily oral TAF-based PrEP is non-inferior to the TDF-based PrEP for prevention in men who have sex with men and transgender women. But to note, the efficacy, how well it works, of the daily PrEP can be as better than 90%, which is tremendously effective. Oral PrEP does work. But what we do know is that this efficacy is highly correlated with adherence. It works if you take it. And that's what you see on the right side of the slide in the IPREX trial, where they compared TDF-FTC-based PrEP with a placebo. A placebo is a medicine that doesn't actually have any active ingredient in it. And when you compare the oral PrEP with the placebo, they found 8 new infections in people taking PrEP if they took more than 90% of their doses, compared to 30 new infections in the placebo group. So there was a difference there. But if you look at people who took less than 90% of their doses, there wasn't very good effect there. So oral PrEP works if somebody takes almost all their doses. We're now beginning to look at long-acting PrEP, knowing that there are some difficulties in some people with taking more than 90% of their doses every day. So having an injection can remove some of the difficulties with that adherence, and the healthcare provider is directly administering the shot, administering the injection, can see the medication going into the person and know that the PrEP has been taken. So that's one advantage that people are beginning to look at. Also, having an injection from time to time, every 2 months, may remove some of the problems with stigma or disclosure that make it really hard for somebody to stay taking tablets at home every day. Also, having an injection that is administered every 8 weeks, some people find that better, more convenient for them, and it addresses what we call pill fatigue. When somebody just gets tired, they get bored of taking tablets every day. And what we do know from preliminary results in adults is that people who had injections were quite fine with them. They didn't find them too bad. Even though some people don't like having injections, generally it was something that people could tolerate, and it was a positive experience. So those are about the injections. Obviously, the dapivirine ring is also another long-acting product that may remove some of the difficulties that some people have reported with tablets. Looking at the injection, again, HPTN 083 and 084 were the studies that reported how effective and safe the cabotegravir long-acting injection was. And this was a clinical trial in MSM and transgender women, and a separate trial was done in cisgender women. And that was a randomized trial. And it was what we call a double-blind, double-dummy trial, meaning that the participants and the trialists, the people doing the study, were blinded. They did not know what product the people were getting until the trial was unblinded. Everybody got an injection. Everybody had to take tablets every day. The first group had the cabotegravir injection and a placebo tablet. The other group had a placebo injection and the TDF-FTC PrEP tablet. And there was an oral lead-in for the first 5 weeks to make sure nobody had a bad reaction to the cabotegravir tablets before the injections began. So that study was truly successful, and it showed that the CAB long-acting injection was superior to the daily oral PrEP and at preventing the new HIV infections in MSM, transgender women, and the cisgender women. And the sub-studies are being planned for the adolescents. They're actually underway, and those data will be coming out very soon. So that was about the cabotegravir for adults, and the adolescent studies have very similar design, but there's no randomization. This was a single-arm study, so all the adolescents who came into the trial received the cabotegravir injections. And the thrust of that, as well as documenting safety, was more on the acceptability and tolerability. What is particular about the adolescents' experience with this product that we know worked so well in adults? How did that fit into these young people's lives, and what do they think about it? So those data will be coming out soon. Then lenacapavir for prevention, and this is a different type of drug. This is one that we call a capsid inhibitor. And it's a long-acting preparation that works with HIV in separate stages of. So it's an antiviral that gets in and HIV virus from getting into the cells and react. So this is a capsid, and it's given as a subcutaneous, that's just under the skin, 6 months. So you can see continuing to study of long-acting PrEP. And this new showed high antiviral, it worked very well against, and a very good safety in a treatment trial. Administered to people living with HIV, and with the lenacapavir injection optimized background regimen that led 3% of the viral suppression. Remember the study. Now the product is moving over to be tested prevention regimen, and the two studies called Purpose 1, where they're administering this subcutaneously once every 6 months. Keep a lookout for from those trials. So those are antiretrovirals that applying where we're trying to get products as an alternative to take it every day. Another product that's in the pipeline are called Bnabs. All right, that's another crazy abbreviation that the scientists have cooked up. Bnabs. So what does Bnabs mean? And that's broadly neutralizing antibodies. Okay, don't ask me, I'm not responsible for that. The Bnabs MOA, or mechanism of action, is it poses multiple threats to HIV. Once again, it gets in and it stops the virus from binding to a cell, And if a virus has managed to get into a cell, the Bnabs call in the hosts, that's our own natural immune system, to catch it and destroy it. All right, so Bnabs are in the pipeline. There's several different ones being tested. They're in the early stages of clinical development, and it looks like we may need to have a cocktail of Bnabs, which will be 1 or 2 or 3, or maybe even 4. Remember how we've had a cocktail of antiretroviral drugs for ART, right? Well, it took us several years to work out that we needed a cocktail. Bnabs, we think we probably need a cocktail as well. So you understand those principles. We're probably going to have a cocktail of Bnabs to administer to somebody. This is, again, it's an injection. So it might be an infusion, like a drip, or maybe subcutaneous, depending on how many milliliters we have to give, because you don't want to be walking around with 50 mils or so in your skin. All right, so that's a Bnab cocktail in the pipeline, early days. But once again, look out, because the study results are beginning to come out about what might work and what's not working and where we are going. So in summary, when we're talking about HIV for young people, that sexual transmission can be prevented. We have various, including condoms, the vaginal ring, oral, and treatment as U equals U. We now know that LongActing may address some common problems that young people might have, stigma that affect the way they take their tablets every day. These concerns may lead to improved adherence regimen. This year, long-acting Capsid every 8 weeks, approved by the FDA, regulatory bodies around the world for adults and adolescents of acquiring HIV. And there are more studies underway to assess the efficacy of other drugs such as and Bnabs for prevention. I showed you that pipeline of different products over the last about 12 or 13 years. It's still going, and we've probably 12 or 13 years before we get many of the questions, because we want young people and adolescents choice of that fit with their lifestyle, that can be delivered to them where they are when they need it. I have to say, thank you. Sit down. I have the pleasure of inviting a youth expert, Joyce, to the voice that really matters, who will share her story and her experiences about PrEP and HIV prevention as a young person. So I'm going to sit down and hand over to the IT people to play Joyce's pre-recorded testimony. Thank you.